Dr. Daniel Burson. Hemorrhoids are certainly not a life and death issue, but they are definitely a quality of life issue. I see many patients who suffer for a long time before they seek help because of concern about the pain of treatment, as well as the belief that hemorrhoids can only be treated in the hospital. For many years, I've treated hemorrhoids in the office with minimal patient discomfort and without the need for hospitalization or anesthesia. Internal hemorrhoids are three groups of veins in the anus which can become distended during pregnancy or with increased pressure from constipation or being overweight. It's not necessary to remove the hemorrhoids in order to treat the symptoms. In my experience, the best method of treating hemorrhoids is to perform an in-office suction ligation of the hemorrhoid. When a patient with a hemorrhoid problem comes to my office, I first want to get a complete history, both of the hemorrhoid problem as well as other medical conditions. The next step is to do a physical examination. The patient lies on the left side and I examine the external anus. A digital examination with a gloved finger is then done. The purpose of this is to assess the sphincter or round muscle, which keeps the anus closed, and to feel for any masses. A short tube called an anoscope is then used to examine for hemorrhoids. If hemorrhoids are confirmed, the first treatment can be done right away. A sterile suction instrument such as this is introduced and gentle suction is applied to the hemorrhoid. The device is activated and a rubber band is placed around the neck of the hemorrhoid. This stops the blood flow in the hemorrhoid without actually cutting any tissue. The whole procedure takes about a minute. Afterwards, there may be some minimal discomfort for a day. If anything at all is needed, Advil or Tylenol is enough. Patients continue their daily activities without interruption and return for each of the next 2 weeks for repeat suction ligation. After 3 visits, most patients are relieved of their symptoms. Overall, patients have been greatly satisfied with this procedure, which keeps them out of the hospital and gives them relief from their symptoms with 3 15-minute visits to the office.